Hello and welcome to this video. In this video we're going to cover a case study or a case scenario of hematuria. So you are in a GP setting, you're in your office, and you're asked to see a 60-year-old gentleman called John Smith. His main complaint is hematuria and he's a handyman. So you allow the patient into your office, he comes in and you will ask your classic question, open question, how can I help you today? So he starts straight away, I saw blood in my urine and I am a bit worried. In this case, you start with another simple question. When you first noticed the blood in your urine and what color was it? It's very important to understand what color is the urine. So the patient says, I noticed it about 2 days ago. It was initially pink, didn't think much of it, but now it's like a proper red color. So you ask your classic UTI infection type question. Any burning sensation when you urinate? This will be called dysuria. Then you also ask if there's any stomach pain or back pain. This is mainly to rule out any type of pyelonephritis type symptoms the patient may be feeling, or a kidney stone. The patient denies any of those symptoms. So you ask more detailed questions about frequency. Are they going more often? Urgency, that they feel that they just about make it to the bathroom, and obviously increased urination at night, which is called nocturia. And obviously you want to ask the questions about fever, lethargy, nauseous, vomiting, weight loss, and stuff like that. Mr. Smith denies all those symptoms. So you try to ascertain a bit more of the medical history, and his history is mainly significant only for cholesterol, which is controlled with a statin. The second background, you find out that the patient has a history of 20 cigarettes a day and has been smoking for about 20 to 30 years, hypothetically. However, everything else is normal. His family history is unremarkable. His surgical history is unremarkable, and he has no known allergies. So at this point, you decide to perform an examination. So in this case, there's not much you can do regards to examination. So you just want to perform, have a look for any sign of lymphadenopathy, which are the lymph nodes, and do a general abdominal examination. So let's just mark the points of where you will look for any lymph nodes. So you want to start with the periauricular lymph nodes, preauricular, preauricular lymph nodes, which is just about somewhere around here. You want to go to the postauricular lymph nodes, so it's somewhere around here, and kind of like go down around somewhere around this place. Okay. There's some other lymph nodes around here, which is a submental or submental. You want to feel around here too. I'm just giving like an idea of how lymph node. Then you have the supraclavicular lymph nodes. You want to have a feel, and you want to have a feel of the occipital lymph nodes too, somewhere around here. Okay, so let's just mark it quickly. Some of them, which is a pre-auricular. That's that. So someone around here is a submental. And this one's around here. Say about this one's. These are the anterior cervical, lymph nodes. Sorry, it's a bit messy, guys, but I guess you get the gist. And these are the supraclavicular lymph nodes. And obviously, like we mentioned, this is the occipital lymph nodes. And this, how do I mark this? This is the post-auricular lymph nodes. It's a bit messy, but you get what we are looking for there. And obviously the main reason you're looking for these symptoms, you're looking for any sign of renal carcinoma. So that's kind of like when you want to have a feel of the lymph nodes. So when you're performing a abdomen examination, you want to have a feel, obviously, of the abdomen. So let's say you want to palpate for any suprapubic tenderness. So somewhere around here. So suprapubic tenderness. Want to have a feel of the flank for any type of flank pain. And obviously you want to have a feel for any masses or any kidney masses, any assess the bladder fullness and stuff like that, just to do a general examination. Most cases, these findings will be normal, but sometimes you may find something abnormal, so you have a bit of a working diagnosis. Walking through the kidney itself, so we can see. Let's talk about the maybe sources of hematuria. So we're going to go through the different causes of hematuria. So let's just mark the kidneys, maybe with the yellow, so we know that that's slightly different. So if we focus on the kidney itself, so let's just put an arrow, kidney, maybe causes. The most obvious one you want to talk about, think about, is glomerulonephritis. So that's the first thing that will come to my mind. The second thing that will come to my mind is IgA nephropathy. So you want it could be like a kidney tumor, or which be just to say renal tumor, which can be benign or obviously malignant. Could also be PKD or polycystic kidney disease, which may cause obviously blood in the urine. Also like trauma may cause this, or let's just put it up here, obviously a stone. So if we go down to the ureters, which is like this tube, like that. the first thing you think obviously is a kidney stone. So let's just say ureters. The first cause of hematuria would be kidney stone, which is probably one of the most common. Stricture of the tube itself, maybe an infection, you know, UTIs and stuff like that, and obviously a tumor, which could be also another cause for hematuria. So then we move down again. So if we move down to this, oh, just the wrong color, but you get what I'm saying. So we say bladder. So the first thing I personally think again is a stone. Another cause could be infection. Obviously trauma, and tumor. So let's just put tumor first and maybe trauma, yeah. Okay, so in this picture, the thing that is missing is obviously the prostate. So if we just quickly draw that, maybe somewhere around here, maybe like that, something like this. That looks crazy. And maybe give it a color like this. Just make it different. So prostate. Okay, so obviously a tumor of the prostate will cause it to have hematuria, sometimes BPH, benign hyperplasia of the prostate, increases of the increased size of the prostate, and maybe infection may cause blood in the urine. There may be other causes that I'm kind of like not mentioning, but I'm trying to mention the main causes or the main scenarios where you may have hematuria, and just the causes around the urinary system. So going back to the patient in front of you, if you're in the clinic, obviously you want to perform a urine dipstick, which is like a quick urine analysis, and then obviously in this case the patient would likely have blood in the urine, which is why they came in. But you also want to send the urine for a culture. If there's an infection, good, you treat the infection, but you still send it for a culture just to make sure there's anything that you may be missing. And microscopy will obviously confirm hematuria if the red blood cells are present. That will be done in the lab. Another thing you could do is perform full blood count to rule out obviously any other causes, anemia. You want to do the U's and E's, check the kidney function, and CRP or ESR to look for any sign of infection. And obviously, this will give you a bit of an idea of what may be going on. And in this case, the finding in the urine was positive. I think for blood. And then, however, his blood results were normal. So we find blood in his urine. There's no sign of infection. We kind of don't really know what may be going on. So this obviously points us towards something malignant, but we still have to have a differential diagnosis. Diagnosis could be bladder cancer, renal cancer, prostate cancer. Again, could still be an infection. Could be prostatitis, pyelonephritis, and other causes like we mentioned in the diagram could be a kidney stone, BPH, or trauma. However, from what we find out from this patient, in my opinion, when I saw this patient, I was thinking along the line of bladder cancer. So what is the management plan? Obviously, you are in a primary care setting. The first thing you need to do after this result, you want to refer them urgently for urological assessment. I would normally do a 2 weeks wait, but depending on how the patient is, you may want to do is send them to the hospital on the day if they're really acutely unwell, or yes, just do 2 weeks wait, 2 week wait. And that's it. Hope you guys enjoyed this video, and don't forget to like and subscribe to my channel, and I'll see you guys in the next one. Take care.